Good morning or afternoon to you. My name is Allison Dahl, and I am the Senior Health Insurance Program Manager, also known as the SHIP Manager, here at Baltimore County Department of Aging. As we are starting off the month of June, it is Fraud Month, and in way to celebrate that, we've decided to train you to become a Medicare Fraud Detective. So I hope you guys are ready to get your detective hats on, because we're about to learn how you can detect fraud through Medicare. So, let's figure out what are our learning goals for today. Well, when you end today's session, you will understand the difference between fraud, waste, and abuse, who can commit medical fraud, the different types of fraud, and the 4 R's, which are essential in helping you protect yourself and others from Medicare fraud. And you will be able to identify fraud and to whom should you report it. The game is afoot, my dear Watson. Let's talk about why it's important to know about Medicare fraud and how you can prevent it. Well, firstly, Medicare lost over $60 billion last year, and it's really impossible for them to calculate the cost of beneficiaries lose during this time. It also jeopardizes the quality of healthcare. So by you becoming a Medicare fraud detective, you will be able to make sure that our healthcare system continues to do well. Elementary, I swear it, sir. So to become a Medicare fraud detective, you must first understand the level of the crime. So what are the levels? There's 3 different levels that we're going to talk about today. The first is fraud, which occurs when someone knowingly deceives, conceals, and misrepresents themselves of their services to get money or property from healthcare benefits. There's waste, an unintentional clerical error, miscoding of a service, or abuse when healthcare providers, suppliers don't follow good medical practices, resulting in unnecessary services and or visits being provided. So those are the 3 levels of Medicare fraud. So let's talk about the level intent, right? So we know that there's 3 different kinds of Medicare fraud. So what are the levels of which they're bad, right? So first is errors. These are like coding errors. Like, if I were working and I'm just typing in someone's bill really quick and I just accidentally typed an extra 8 and it billed you for something different, that would be an error, which does lead to waste. So that's also like ordering excessive diagnostic tests. So like if you feel that your doctor is sending you for tests that really aren't showing you what's wrong with you, that might be a waste. There's abuse when they are intentionally doing improper billing practices. And then there's fraud when people are purposely billing for services or supplies that were not provided. Now, I want to make a note here that since we have a judicial system here, right? If you call me and say, hey, I want to report fraud, I would be saying, well, tell me about your potential fraud case, because we allow the judicial system to make the final decision if the case is actually fraud or not. Examples of the fraud. So Medicare or Medicaid is billed for services or equipment you never got or returned. So if you received a knee brace, or you got a bill saying that you received a knee brace, that's an example of Medicare fraud. A provider bill for services that would be considered impossible. So let's say you looked over your statement and you realize that you're being charged for a service that you were out of town for, then you know that that's a fraud. Someone changes documents to get higher payment. Now again, this could just be different types of numbers, and then that way the doctors can make more money. Dates, descriptions of services, or your identity are misrepresented. So if someone gets your Medicare number and they say that you're you, and again, if they are the dates don't match with what services that are actually provided to you. A company uses false information to mislead you into joining a Medicare health or drug plan. Now, this can happen with brokers. So if you speak with a Medicare broker and they talk you into signing up for this plan, and then you realize this plan does nothing to benefit you, that could be considered a form of fraud, because maybe that individual did that unjustly because they wanted an extra commission check. Now, that does happen. And then someone else uses your Medicare or Medicaid number. So we know what the level intent is. We know what are some examples, but let's figure out who our suspects are. So unfortunately, doctors, pharmacists, and other healthcare providers and staff could be the suspect of our Medicare fraud case. Also, durable medical equipment, DME, suppliers, hospitals, pharmacies, home health organizations, ambulance services, and billing companies. Now, this could be if, for example, when we talked about that knee brace earlier, if you received a bill saying that you got a knee brace, but you never received it and you didn't need it, that's an example of a fraud. Individuals with Medicare or Medicaid, or individuals who have stolen their identities. So unfortunately, identity theft is something that we are seeing more and more of, and this can happen with someone taking over your Medicare number and saying that they're you and using your number for services they might be receiving. And then telemarketed companies and health plans. So if someone calls you and gives you a lot of pressure to sign up for a health plan, that could be a source of fraud, especially if they start to threaten you. So let's follow the trail. These are the 4 R's that we talked about at the very beginning. 1, you want to record. Write down information at doctor's appointment or when you've placed orders for tests or medications. So take out a calendar. Say you have a doctor's appointment this day. If the doctor says, hey, you might want to go and get tested for your blood work for these days, make sure you document on your calendar what days you're going to get your blood work done. So that way you can record and have evidence when you get your statement back. Review. Look at your MSN when it arrives to you quarterly. So that's your statement, your monthly statement. Take note of any changes that you do not recognize. So if you were ordered to take a test but you didn't go for the test and it's on your statement, that's something that you might want to look into. Report. Call your local SMP office, that would be me, to report your concerns or any suspected fraud. And then remember, protect your personal information like your Medicare or Medicaid, Social Security card, and bank account numbers. You want to keep those close to you. Make sure you don't have those out, and if anyone on the phone ever asks for it, they're most likely not there to help you. They're most likely someone that's trying to steal your information. If you were to call the SHIP office and we needed that to assist you, that's different. But you want to make sure you know who you're giving out your Medicare number to. So you might know what this is. This is your MSN right here. Let's take a closer look. So this is an example of an MSN. You can see here that it has services provided and billing code. This is where you want to make sure that those statements match your records. That's why it's really important that you have a calendar with all of that information. Any services that you're receiving, the calendar date that you went, maybe even take note later of the costs. And then you'll see here you'll have that a service was provided, the cost of the service, and then how much you pay. So this is really important information that you keep track of all of this information for your knowledge. So when it is time, you can compare it to your MSN to your calendar. And then always make sure to check to see if they're duplicates. People make human mistakes, and that could be one of them. Reminders. Don't share your Medicare number. Protect it as you would a credit card. Keep it safe, okay? Medicare does not call. So sometimes people pretend to be Medicare and they'll call and say, hey, this is Allison from Medicare. Hang up. They're not from Medicare. If you lose your Medicare card, you must contact Social Security Administration. If you have any questions or you're suspicious, you should just call and report it. Never accept free medical equipment or services in exchange for your Medicare number, because nothing is free and you shouldn't be sharing your Medicare number. Don't let anyone talk you into stockpiling equipment for later use. If you need equipment, obtain it through your regular doctor. A lot of times people that are doing that are just trying to get you to purchase it, and then they won't even send it to you. So make sure you know, do not get talked into stockpiling for services and equipment. If someone calls and tries to pressure you into something, hang up. They shouldn't be pressuring you into anything. Beware that you are responsible for the 20% of the Part B cost. Frequently, scammers do not explain that. So if they call you and say, hey, you're approved for this program where you can get free supplies, that's not true, because you're responsible for 20%. And the Medicare does not make home visits. If you see someone coming to your door and they're knocking on it and they're saying, hi, this is your friendly Medicare representative, don't answer the door. Just keep it shut. And if they do see someone doing that, make sure you get their information to report them, because they do not come to your door. So, how do you close the case? Well, let's say you have what you think a suspected fraud case. You want to report it. So you want to make sure you contact your local SMP, or you can contact Medicare directly. Why do you do this? Well, it saves taxpayer money and it protects others from being a victim in the future. And then here's how you can report it. Our email is right there, medicareinformation@baltimorecountymd.gov, or you can call us at 410-887-2059, and I will be able to assist you with reporting what you think may be suspected fraud. Other resources that you can contact is Medicare itself, the number is there, and then the Office of the Inspector General. Their information is here as well. And that's everything. Thank you for joining me for this great Medicare talk. We'll talk to you next time.